Hello, everyone. Welcome back to another episode of the Practice Perfect podcast. My name is Jennifer McNamara. I'm here with my lovely co-host, Maya Turner. Hello, Maya.
Hey, how's everybody on this Wednesday?
Oh my goodness. It's amazing. I'm so excited for today's episode. It is a
Yeah.
topic that we talk about often when we have to, but sometimes it's just, oh my goodness. Sometimes people just don't understand. And you know why they don't understand? Because they don't read policies.
Uh-oh. Yeah. It's a topic that we as coders, as billers, and as part of the revenue cycle is important to understand the difference between statutorily excluded and not medically necessary. There's a huge difference between the two, and I think we need to talk about this because this means the difference of viable collectible income when explained the right
Mhm.
way.
Exactly. Now, we are huge patient advocates, and we are not trying to give you little ways to cheat your patient. That is not what we're doing. We want patients to be aware of their obligations, just as we want our medical practices to be aware of their obligations. There are services that you can collect on that are not covered, right? That patients are responsible to be paying. They should understand that. And you can explain that in a tactful way. I think that that is some of the issues that we face, unfortunately, when we do some of the work we do, Maya. We see less tact more and more, not only in the office, but just in the world, right?
Right? Oh, yes. All right. We don't life moment. Be kind.
Be
That's
kind.
it. Be kind. That's a life moment. And what's really interesting about this entire process is it's a legal responsibility. There's some legal um, components that are tied to statutorily excluded, medically necessary, and the patient being well informed of either because it results in their responsibility and your ability to collect. There's conditions of participation for Medicare that absolutely outline all of this in this framework.
Yes, and we will be discussing the ABN form here in a little bit as we get to that portion of the show, because that really comes into play with understanding when you should give them one and when you don't have to, and
Yeah,
when you might do it just for to be nice, just to let them know what their cost is, but you don't necessarily have to do it legally. So
right.
we'll talk about that. So let's talk about literally what does statutory exclusion mean according to Medicare, Maya?
Okay, well, let's break this down, folks, for the people in the back.
People in the back.
What what people means what it means when something is statutorily excluded, that means that the benefit is not covered. No matter what way you shape it, no matter how you frame it, it will not be covered. An example is the annual preventive visits. The codes 99381 to 99397 for the E&M services. They are never covered. So if you use those codes for your Medicare patients, guess what? You're going to get a denial every single time because they're considered statutorily excluded. What else is statutorily excluded without medical indications as of 1/1 of 2025 is dental services. You will
Mhm.
never get dental services covered under Medicare. Never, ever, 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 ever.
And then we have, and the world I live in, ophthalmology and podiatry, is we have, some of the refraction that we do for the glasses, like that is
Yes.
not covered. And then routine foot care is has its own little island because it's a maybe. And so there are, we'll talk about that one because that's one that we deal with in podiatry on the daily. If you're attending the Bone and Joint Summit on July 17th and 18th, you're going to want to pay attention to Dr. Lerman. He's going to break down routine foot care. We're going to have a good time with that. We're going to talk about that. And then Miss Tanya Silva is going to talk about some of the compliance issues there. So we're really going to have a great conversation there. But we'll break down a little bit today just so you understand how that works. There's cosmetic surgery, right? And like Maya mentioned, the routine physicals, hearing aids, because I work in ENT, like you have that. Things for personal comfort, right? Unless you have a MA plan that will pay for your refrigerator because you have medication that needs to be like cold and your fridge breaks, like there are crazy benefits like that exist in an MA plan, but that's not a Medicare benefit necessarily.
Right.
So those are things that we don't equate to Medicare, right? We don't equate that to them. So the risk is there, guys, in getting paid or not getting paid. Like those are the things that we deal with. What is the risk of not getting paid, or even the payment we received, do we get to keep it? That's always the question, right?
Right. I mean, and even if you don't recognize any of, if you, the point is, let's really break this down about compliance. And compliance comes into play, you know, the goal, I don't know why my face keeps going in and out. It's doing something weird today. But hello.
You're here, I see you.
Yeah, okay. So one of the things that you have to really recognize, especially when you're working the front desk, and this is why the front desk's role is so pivotal to the practice, right? You got to recognize when it's not medically necessary and or when it's not covered, right? Because between the two, right, when it's not covered and the doctor may deem it medically necessary, then you have to sign what's called an ABN, and we'll go into that. But again, your staff needs to be completely aware that it's not a covered benefit, like chiropractic services. Only Medicare only covers certain things that are related to chiropractic services, right? But your front staff needs to make sure that they are aware, even though it's part of their treatment as being medically necessary, it is not covered. An ABN should be on file, and it can't be the same ABN. It has to be a new ABN every single time, folks.
Every single time. So here we go, guys. We're going to give you the 411. And I thought, today, if you're watching us live and you can see us, then it's really awesome if we just like share with you this deal here and we just go over it together as a team, as a group. So let's do that. Let's look at this together. So I'm going to scroll down here and we're going to look at this. So this is the link here for Novitas, which is the MAC that I live in. And so many of your MACs will have their own maybe take on things. It will give you, of course, the CMS Internet Only Manual reference. So you can get the actual reference of where this came from in the claims processing manual. So ABN notifiers, these are the people that will potentially need to notify a patient that something is non-covered. So there's instructions, as we know. I'm going to scroll down here really quick to the actual image of the form here. I don't know if it'll let me zoom in. Let's see here. If I can zoom in here for you guys. Oops, too much. Can we see that okay? Hopefully we can see that okay. So this form is the one that this is the form that we give everybody when we're doing routine foot care or anything that's potentially non-covered. And we have to fill it out correctly, right? So Maya, walk us through this. Like, what is something we need to be aware of? What's the first step we need to identify in this form?
First, you need to understand the service that is not covered. It's broken into two buckets, right? The cosmetic procedures done for appearance, those types of things, it needs to be broken down completely. So when we think about what is not covered, one, you got to understand what's not covered and the reason why. I keep disappearing. I feel like I'm in a disappearing act. Hold on, let me see if I can fix my camera. Okay. All right. Can you see me? All right. Now you
Yes.
don't. You see me?
I think
Now
it's
you
the
don't.
color of your shirt. It might be the color of your shirt against the background. Like that happens sometimes.
Oh, okay. So maybe I need to pull in a little more. But the first thing you need to recognize about the ABN is that the service that's going to be not covered. You have to clearly identify the type of service that is not covered, one, and the reason why it's not covered. And then there are certain things that you need to outline to the patient that's related to the ABN for the reason, right? So if it's not covered, it'll say that it's not medically necessary or what have you. But then the second part is outlining how and what needs to happen prior to, right? The reason why Medicare is saying that it's not covered. Then you have the patient who has to acknowledge that they
Hmm.
still want the service.
Or don't
They
want it, right? Or
or
don't want it.
don't want it because part of the ABN is to notify the patient prior to, and I really
Advanced. Yeah.
advance. And there are three types of notifications for non-coverage. There's one for the hospital, there's one for outpatient services, which is the ABN, and then there's the observation, the mandatory observation outpatient notification, the important message from Medicare, and then there's the ABN. So again, these three things are major components of the ABN process to help you identify when a patient and notify that the patient is not going to have a certain service that's covered. And because of that, this is just one of those components. You have to let the patient be well aware what's taking place, why it's taking place, and if it doesn't, if they consider or continue to consider the service, they have to sign it and acknowledge the date. Once this happens, this tells the Medicare provider that they can bill with the appropriate modifier, indicating that it's that they've signed it, they've acknowledged it, and when Medicare processes the claim, they're able to bill the patient. Otherwise, Medicare didn't recognize the modifier, and they're going to say you're going to eat it with salt and pepper.
Right. And we'll go over those modifiers here in a minute. But the important thing is to make sure the patient is aware of what these options mean to them. That, yes, I want the service. You can ask to be paid now, but I also want you to bill Medicare for an official decision, which that's how you get your denial. And we'll talk about some nuances with the E&M code and the procedure. And then we have option 2, I want the service, but do not bill Medicare. You may ask me to pay you, and that's fine. I don't want it. I don't want to pay it. I don't want you to send it. Like, let's just not do this. So those are the 3 options, and they sign it, right? Every single time there is a service, like Maya said, like we don't just have them on hand pre-filled out for a certain service. No. They have to be filled
No,
out at the time, and there's a workflow that goes into that because it's not the front office staff that does that, guys. Maya, who's the one that fills these out?
the patient, but they have to be explained why. They have to be notified on how and why it's not covered, and ask them if they understand, and so that they can make an informed decision. That's what's called informed consent for treatment.
Right, exactly. So the patient's gonna have to fill out, let us know like what it is. But it would be good if like usually it's the medical assistant or even the physician that will say, this is what it is, this is why it's not covered. And then you have to, so it's kind of like a joint effort, the way I see it. Like the back office, the person talking to the patient before they have the service, right? Whoever is
Yes.
talking to them about saying we need to do this is what we have to deal with. That means education. That means the medical assistant or the nurse or whoever is talking to the patient before the procedure is done is going to have to know this. They're going to have to be educated as well. So we want to be very careful about understanding that. There's some information here about, keeping the copy and everything, but I want to scroll back up to the actual modifiers, guys. This is where the fun part is, at least for me.
Yeah.
What I'm billing, I'm getting the right bill, the ABN form, modifiers on there. Let's start with the GA modifier. So the GA modifier tells us that it's the general waiver of liability. Basically, you are reporting that an ABN was provided and there is a likelihood of denial. You're saying, I'm going to submit it, because you would only use this if you're actually going to submit it to the insurance, right? They're going to receive that GA saying these reasons here that we're giving you are one of these reasons is why we are attaching the GA modifier. Now, sometimes for instance, podiatry, when we're doing this, we have to put the GA on, and we also have to send the E&M code, which is a payable service. If we submit the claim without a modifier for a non-covered service, we're going to get a denial across the board because they're going to deny the entire claim.
Yep. And
So
what's
that's
really
important.
important, yeah, and what's really important is even when they do sign it, this GA modifier lets Medicare know to adjudicate the claim, to let the patient know that they have the responsibility. So it's
Right.
not just about the ABN being signed, it's about the GA being appended so that the patient knows that they have their responsibility to pay and that they have acknowledged this. So appending a GA without an ABN and billing the patient is illegal. But if you have an ABN on file and you don't report it to Medicare, that's just as important so that you can bill the patient. So it's very important to know what these modifiers are and how they reflect your payment, your ability to pay at the practice.
And keep in mind, this modifier here is because you're issuing an ABN form because there's a reason to issue an ABN form. We're not talking about statutory exclusion. We're talking about non-covered services, non-medically necessary or non-covered, right?
Yes.
But things that are statutory excluded, this is where the GX comes in, because we're giving them a notice of liability, voluntary, because it says here, because Medicare never covers it, because it is statutory excluded or it's not a Medicare benefit. That's GX.
Right. And
Okay.
those are hearing aids, dental care, refractions, personal comfort items. This is what you would append when you're providing a service. That's voluntary, but you're appending the GX modifier and you're letting Medicare know they're going to not cover it anyway, but just simply letting Medicare know that the an ABN was issued and that it's an statutorily excluded benefit.
Yes, and GX's cousin, the GY, is also available if you're only using it just to report that you're submitting a non-covered service. But you can use them both, because it says you can use GX and GY in combination. If you're not going to give them a voluntary ABN, then you would only use the GY. If you're going to do both, then you would use them together. The GY
Right.
is to notify Medicare that you are submitting a claim that has a statutorily excluded service on it. And of course, you with the entire claim pay, you're just telling them the situation. But together, they tell the full story that, yes, I know that I'm billing a service to you that is non-covered. I expect you not to pay. But I also want to let you know that I issued the patient a voluntary ABN form.
Yes.
Clear as mud, right?
Yeah. And we talk about this in the Medicare preventative uh, platform for MeduTrain. So if you
Yes.
haven't purchased that Medicare preventive services, this is really important for services that are out of frequency, and those types of things. And we break all of the stuff down in the that presentation. So if you haven't done so already and you're interested in learning more about preventive services, we strongly suggest you take a look at that so you're able to get more information specifically regarding non-covered services for preventive services like, the annual wellness visit, the Welcome to Medicare, those kinds of things.
Yeah, so Maya has an excellent presentation on mdutrain.com, and also, again, a great booklet that she put together that's also available to download that gives you that visual. You can show it to your physicians, use it as a training opportunity in a training session that you do with your clinic. So it's a great opportunity to use maybe one of your training sessions that you do, just focus on, some of the things in that booklet. That's really helpful. So then we have the GZ modifier. An item or service expected to be denied as not reasonable and necessary. Okay, so no ABN was given. You expect to not be paid because you dropped the ball there, guys.
Yeah, but how many providers actually report this?
Oh, I know. My gosh, it's like never.
No, 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 they never do. And it's to be quite honest with you, the GA and the GZ coincide, right? Because you know that it's not going to be covered, but the GZ is saying we didn't tell the patient. The GA is saying that you did. But in either case, it should be reported so that you could properly uh, account for the revenue and adjust it off the right way because you have the EOB or the remittance advice to support while you're writing it off.
Exactly.
Uh-oh. 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 Did I touch a nerve, folks?
Well, Maya, that it's important. We like to touch the nerves because that means that something needs to be changed.
Yeah,
It means
absolutely.
that you're sensitive to it and you need to make a change, right? So
Absolutely.
what I will say is to remember that these forms do expire and get updated. So
Yes.
as you see on the website, you will notice that the more recent one became effective June 30th, 2023, which means they're going to be changed. And so the next expiration date is January of next year. So
Yes.
we are less than a year away of a renewed form. So make sure to put on your calendars, remind yourself to be using the new form when we get that available. So just a reminder on that. I know that was a lot to dig into, and I know you're going to want to go into our show notes on practiceperfectpod.com, and you're going to want to get this link for either Novitas. We're going to put the link to all the Max information on this in our show notes on practiceperfectpod.com. So you can go there, find the episode, find all the downloads and the links and things that you need to keep you organized in relation to this episode. So I hope you enjoyed digging into that with us. So I think it's really important that we focus on the guidelines. You know, when you're billing Medicare, you got to know what they expect, right? And this is one of the biggest things that we just don't seem to get. Now, another thing that I want to dig into is we have the form, right? But let's just talk about in general the things that would be considered not medically necessary to a payer. So we know what the form is used for, but in general, like there are things that are obviously not going to be paid because guess what? You didn't read the policy. They clearly tell you in their local coverage determinations, Medicare, and their national coverage determinations, what is covered and why.
Right.
I don't know. I just feel like some people just don't even bother.
Well, I mean,
And I don't know.
I think, when you're dealing with these types of situations, it's about making sure that your front desk staff is very well aware, right? This is where training comes into play. This is why you need to know the workflow of your office. You need to know your patient payer mix. So the bigger question is, right, if they're not Medicare, do you still need to notify them of non-coverage? Absolutely. You still need to let them know because there is a obligation by the provider called financial responsibility. If you don't have that on file called financial responsibility, that's just as bad. So the patient needs to be very well aware of what's covered, what's not. And if it's not covered, they need to know what their obligation is so that you can bill them. If there is no financial responsibility clause or anything that they've signed to acknowledge this, they cannot be billed, period.
Listen to this
Unless
woman. Listen to Maya. She knows what she's talking about.
unless there is the contractual obligation under the insurance. But if there is not, and it's considered self-pay for whatever reason, and the financial obligation is not on file, that is a legal obligation. If it's not there, you cannot bill the patient. I'm sorry, I don't care if you do it all the way, you're breaking the law. That's a requirement. I'm sorry. I'm off the
100%. 100%. So, as we talked about, there is a distinction between obviously statutory excluded and non medically necessary. And the distinction is important because it's the difference between getting paid and not getting paid. And someone's paying you, either the patient or the insurance. So you need to get it right so you know who's paying you. I mean, I want to know who's sending my money. Like when I have an invoice out to a client, I want to know who is the responsible party. Do I contact the AP department? Do I contact the revenue cycle director who's going to manage getting me paid? Who is the person that's going to give me the money? Like,
right.
show me the money, right?
Right. Jerry
So,
Maguire.
yeah, absolutely. Oh my gosh, that scene is hilarious. Anyway, crazy. So let's talk about just the fact that we have tools out there to even help us manage this. There's AI out there, guys. Shout out to Athelis, one of my favorite tech companies right now that has the tools and has the means to help you get this right and stay organized. And that's the thing is
Shout out
there's
to,
so many.
I'm sorry,
Go
go ahead.
ahead. No,
No,
go
I was
ahead.
going to say shout out to Cameron, Cam the man, who gets it done. He's just an amazing guy. I honestly believe that this software is really going to change the way a lot of the way that a lot of show providers view their revenue cycle. And again, we're in a day and the age where automation is not replacing, it's augmenting. AI is augmenting the ability to capture revenue. So using a product like Athelis is going to really change your outlook, your projections of revenue cycle. So you really need to start thinking about the day and age where there's not a lot of manual work. This creates a lot of automation work that would take hours and hours, where if you used things like Athelus to help with your revenue projections and assist with collections.
And it's true. There are a lot of organizations that are they're understaffed and they don't have the staff that is properly trained. They don't have time to stop and train them. Now, our organization does the training. So we can train your staff if you need them to be trained, but you can also
Absolutely.
use tools like Athelus to get you mass amount of data processed for things that you can train it to do that you don't necessarily need a human all the time to do, but there definitely are tasks that a human being needs to review. So it's a partnership, right? Whenever you use any tool, it's a partnership. You're not having it replace the human, at least not right now. It's not there yet.
Right.
If that ever
Yeah.
happens, oh my goodness, watch out. But it will be the future more and more as we see things changing in technology. I mean, technology's come a
Absolutely.
long way since we started seeing tech come on the scene, decades ago. It's changed a lot, right? So there's a lot of things that are available that are beneficial, that are not going to replace us, that are going to make things more efficient, because we want to make sure that we're not writing off these denials, right? And making sure that we're not writing off things we don't have to.
Right. Right. I mean, I think that's a huge, huge point, Jen. And I think because we're in an age where AI, people are afraid of AI and they think it's going to replacement, but AI is really augmentation. And if you look in the CPT book, there is a an appendix, I think it's Appendix S, that talks
Yep.
about AI, that is augmentation.
Mm-hmm.
Augmentation, not automation. Again, it's there to enhance the revenue cycle process. It's not going to collect on its own. It's going to work in partnership, like Jen said, with everything that you're doing. So stop making so much fuss about what your office staff isn't doing. They can't capture everything. So let's think about it this way. And I'm on my soapbox, Jen. I'm on my soapbox. If
Stay on it,
your
girl.
if your insurance company is using AI or using automation to process the claims, why do you have a staff manually looking at claims? You should use the same process they're doing so you could keep up with your revenue the way that they're paying your claims.
Mm-hmm.
Let's think
Absolutely.
about that. You cannot do everything by yourself, especially if you're a multi-specialty practice with $2 million out in revenue. You need to start thinking about modernization and standardization inclusive to your office with AI practices.
Right. Recently, we heard there was an issue with one of the clients we have, and it was a mass project that they need to capture because there was a glitch in their EMR, and thousands and thousands of E&M charges were potentially billed wrong. And the average coder, like say they have like 4 or 5 coders on staff, the amount of lines of data that they would have to process would take them way past the timely filing for these claims. There was no way. It was just so much. It was a hospital. It was, thousands of these lines, and it's insane. There's no way the average person can do it. So if you have tools that can go in and do that, guys, there is actual AI that can go and sit on hold for you at an insurance company. Like,
Yep.
I mean, crazy stuff, right? There's things that it's doing that is saving so much time when you can focus on more, needed tasks. Now, I am a huge advocate of making things better, not worse. So what we're doing is we're seeing people work harder, not smarter, when they should
Right.
be doing the other way around. And
Right.
training and prevention, those two
Yes.
things together.
And let's not forget the front desk, right? The front desk,
Mhm.
they're the core of the office. The smile, they're the tellers, the bank tellers of the
Yes.
insurance money. And the way your money is counted when they walk away from the desk, that's the way your money is counted when the revenue is billed. So think about that. You have a responsibility to make sure that your staff is valued, so they understand everything that's going on with the office, so that at the back end, when it's time to collect, You don't have a bottleneck because somebody transposed numbers. You don't have a bottleneck because somebody didn't put the right insurance in or build the wrong insurance. This is where training comes into play. This is where their value is important. So think about that when you're dealing with your front desk, and let them know that they're valued and how much you depend on them to get that right information.
Exactly, exactly. And, there is so much that we are planning to educate on in this avenue at the Bone and Joint Summit. So even if you are not in ortho, if you attend day one, so that's it should say July 17th and 18th. So ignore me, 17th and 18th. So July 17th, 2025 is day one of the Bone and Joint Summit. Make sure that you're in attendance because we are going to have amazing education. We have 2 AI sessions, guys. We have Dr. Kush Singh, going to be talking about just
He's
in general.
amazing.
Oh, he's my favorite. So he's going to be talking about AI and the aspect of the actual tool itself and using it properly and using it efficiently. And guess what, guys? The amazing Sean Weiss, the compliance guy, is doing AI session,
Wow.
guys, on this at the same day. And so we have 2 tracks, guys. And Sean's session, he just spoke on this at AAOE. That's the Administrators Conference for Orthopedics. It went crazy. They went crazy for this session. So you're going to get what he presented, the compliance guy, at AAOE. You're going to get that at the Bone and Joint Summit. It's worth your time alone just for that session to pay the ticket because it's not
Yeah.
expensive. We have sponsors, guys. These tickets are not expensive. So even if you can't get your employer to pay for it, it's very inexpensive to attend the first day and even the full conference. So please do your best to get your employer to pay for you, or if not, try to pull out your money to just get yourself there. There's 16 CEUs, 8 CEUs a day. It's going to be a great event. We also have coming up on June 6th our general surgery coding summit, where we're going to dig into colonoscopies and colectomies, hernias, trauma, skin procedures, all the things that general surgeons do on the daily. We have the breast coding. If you're in plastics, we're going to do a session that includes biopsies and, the actual mastectomy, reconstructions. So even if you're not in general surgery or in plastics, you're going to benefit from that session. It's a great session. I just sent out the swag for the conference, so we're excited for attendees to get that swag. And guys, I know I've mentioned it. We have an Etsy shop. So I just had to share with all of you some of the cool, amazing products that are on our Etsy shop, guys. So let's have some fun for a minute. If you're live here, we'll also put the link in the show notes. We have some really cool merch. One of my favorites is this new Ivy League. This is the new Ivy League tote bag for Nursing Week that was out last week. It's still available. We have a lot available for this, so I hope you guys can enjoy that item. And then we have some really cool stuff, t-shirts. One of my favorites is the GOT PSA C61. Shout out to our coders that submitted the request for this t-shirt for prostate cancer. So we have a hat and we have a t-shirt. And one of my other favorites is the compliance officer tote bag. If you're a compliance officer, you need this tote bag in your life. And I am wearing today one of my favorite t-shirts. I'm going to stop sharing so that I can show you. Denial approved, Denial Whisperer. I speak fluent modifier 25. This is my new favorite shirt. So you guys need to go grab it. I'm going to be toting this around at May Mania in Knoxville this next weekend. So stay tuned for that if you're going to Knoxville. Maya, what do you have coming up soon? Like what's on your agenda the next week?
Oh my gosh. Well, one, I have a lot of court stuff. I have a lot of depositions that I'm doing, but then I'm also going to our very, very high-end, very successful partnership for the Fox Valley Medical Associates. I'm doing their audits for evaluation and management, and I'm giving the physicians feedback. And again, when you're dealing with a large multi-specialty practice and you have a compliance plan, or you're interested in how your providers are doing, make sure you have an audit for them, make sure you're able to gauge how they're doing, what they're coding, because that's going to gauge if you're losing or you're overbilling revenue that you shouldn't get. That's very important in your overall office management, auditing. If you don't have it, start doing it. It's going to gauge your projections for auditing and making sure that you're on track with what your projections are for your practice. Real talk, folks. Real talk.
100%. So we are very excited. Next week, guys, we're going to have an amazing episode on the other bad boy, G2211. So we're excited to give it its own episode. Finally, it gets its own episode. So we're going to talk about specialty specific examples, because we know obviously primary care is one of the big ones that gets it, but what about our specialties? So we're going to talk about some of them and how they should be using it and some examples and things like that. So stay tuned for that. We want to thank you everyone for joining today. We had a great time talking about statutory exclusions and medical necessity. So I think it's going to be a great episode to replay and replay and replay. Check us out on YouTube so you can get the full video anytime you want. And stay tuned. We will see you next time, guys.